It can be really intimidating seeing children. I was scared when I had my first baby in my schedule, and I went up to my boss and said, "What am I supposed to do with this kid? Why is this patient in my schedule?"
I don't know what to do with this patient. Even though I had a little bit of training back in hygiene school, we didn't see babies on a regular basis.
I don't know. They don't even have teeth. What do you want me to say?
That was the day that I went from panic to purpose.
Now I know.
And it was at that moment I realized our entire profession was unprepared for this population of patients.
I help dental offices identify and be able to assess infants and younger children for oral development problems. And I'm able to help them bridge the gap between knowing what those problems are and then what to do about it.
So when we have a baby in the dental chair, what are some things we can look for?
We can talk about how are they breathing. We can talk about how is their mouth growing, how are they feeding, how are they sleeping.
It's not just the teeth. Everything that a baby does today, including eating, speaking, sleeping, breathing, will actually affect the way their face, mouth, airway develops tomorrow.
My mind was blown by Joy Lantz.
It's just a phenomenal experience to hear her speak.
The earlier we catch these issues, the bigger impact we can have. We need to know the red flags.
She was the person at the store buying all the bottles on the shelf, trying to figure out how to feed her baby. And once we looked in her mouth, we were able to see the tongue tie. And Mom was shocked.
These stories are not rare. They're everywhere. They're really just waiting for you to uncover them. They're waiting for you to ask the questions. They're waiting for you to make that connection.
When you can sit across the room from a parent and look them in the eye and validate everything that they felt in their gut, because they know something's wrong with their children, but they don't know what it is. When they come to our office and we take that hour to do our consultation, they're so happy. They're so happy that someone's listening to them. They're so happy to understand what's happening with their child. Because as a parent, I'm a parent, you never know if you're doing things the right way.
Because parents don't need Google, they need you.
It was just an eye-opening experience for me to hear how integral and important that kind of care is in a small child.
Those years can be so formative and have so many ripple effects.
I understand that this is intimidating. You think, I wouldn't want to do that in my practice. I felt like that. I totally understand. But once you know, you can't unknow. It opens up a whole new world.
It's just such a passion-driven message that she shared. Bring her expertise, bring it into the room.
We're not just shaping a smile, we are shaping their entire life.
All of this is in our world in dentistry. We just have to understand what to look for, what to do, and how to help. We can actually guide their growth and give them an amazing foundation for their entire life.